I'm really excited to introduce our next guest, Dr. Ratansi. I'm so happy to have you. Thank you so much for being here.
Well, thank you. Thank you for having me.
Well, before we get started, I would love to know a little bit about your background and why you're
Okay.
so passionate. I'm sure everybody wants to hear.
Oh, excellent. Well, my background is in naturopathic medicine, and I've been practicing naturopathic medicine for about 20 years now. Primary focus with hyperbaric oxygen therapy, and just generally with naturopathic medicine. Um, the other main focus is my undergrad was in nutrition as a dietitian. So integrating the best of nutritional care along with oxygen and as a naturopathic doctor, the importance of the environment and the environment inside the body, which is why we like to focus on the detoxification aspects of the body as well.
And so, a lot of people really don't understand the difference between a naturopathic doctor, a traditional, doctor that they might go to growing up, like their pediatrician. And so, what is the difference between a naturopathic doctor and more of a traditional doctor?
Well, I think, a naturopathic doctor traditionally is trained to spend more time talking to the patient and getting more awareness of the causes of disease processes and what's going on inside the body, more functional testing and trained in diet and nutritional um, changes that can be focused. One of the keys that you'll find a lot of naturopathic doctors gravitate to is an anti-inflammatory diet, a diet that reduces inflammation in the body. Now, it's not for everybody, but for a lot of people, it can make a big difference on their general health, whether it's from migraines to asthma, right up to neurological conditions, and even seen in autism. And you'll see kids that respond well when you take some foods out of their diet, gluten, casein. Um, these are foods that can induce more problems, physiological stress inside the body. And by getting to know the patient, know the diet, and then know the environment as well that they're growing up in. And are they around various chemical exposures, be it air pollution inside the body, what we call um, indoor air pollution. How was, if you're talking about autism, how was the mother in the um, in the in the trimester, in the various pregnancy stages? So really looking at the environment inside the body at the time of growth and development.
And I know you could spend a lot longer with somebody in your, like when somebody comes to you for an appointment,
Yes.
a traditional doctor, you might get 3 to 5 minutes if you're lucky.
Yes.
In the naturopathic world, is it a little bit longer that you can spend?
Yeah, traditionally, like I said, most naturopathic doctors on that first initial visit, you're looking at about an hour, hour and a half, sometimes even longer. It takes time to get an understanding of where the body is in in that disease progression and what type of layers that we can get into to help the body in full functioning. And one of the big things is reducing stress. And the stress might cause oxidation and inflammation, but it's stress. So is it bacteria, viral stress? Is it some type of bug? Do we have stress from the diet, stress from the environment? Heavy metals, mercury, lead, these are stress to the body. And so um, being able to, by probability, say, okay, um, let's start with a lot of times the diet in the GI tract. And this is for most people as well. If I put my finger right here in my mouth, you're eating food. That what I'm putting is a tube. If I go all the way down, that tube is representative of what finally gets out of the toilet bowl. So basically, we think it's inside of our body when we eat something, but it is related to the outside environment, even though it's inside. And that's a different environment than the body environment, the outside environment. And that's why we have the stomach with stomach acids. We have bacteria that thrive to support their body, called good bacteria. And we want to maintain the best environment for the digestion and for these bacteria. So naturopathic medicine doctors always look at the digestive tract first and see how is digestion going, and then absorption and assimilation, and what happens when those the GI tract gets damaged, and what gets inside the body and what's causing inflammation or immune reactions. And that's why if we start with the GI tract, clean that up, then the inside of the body, which is a different environment, different pH, can be more supported. So a lot of times just making simple dietary changes.
And that's something they can talk to a naturopathic doctor in great detail.
Yes.
And so I know a lot of people still don't maybe understand, a naturopathic doctor. Do they still go to medical school? Is it the same type of amount of years that a traditional doctor might go?
Another great question. You'll see various states have different. If you're a naturopathic physician and you've gone through an accredited school, and there's a few accredited schools that you can go through where you'll get both conventional training and this naturopathic training. And those doctors in regulated states, like what we're in California right now, or Washington State, Arizona, they are then considered in primary care and being able to handle that primary care. And that's important to make and understand the difference between naturopathic doctors that are trained in these university setting as opposed to someone who's gone through naturopath training, which you can get online, which there's nothing wrong with that, but they wouldn't be able to practice in a regulated state as a naturopathic doctor. Take a state like Florida, where you don't have a body or regulation for naturopathic medicine. So that's those unregulated states. You can have someone being a naturopath or a naturopathic doctor, and you need to ask them, have you gone through the 4-year medical training accredited school for being a naturopathic doctor?
So that's good to know. And
Yes.
so now I know some insurances are even, cover,
Yes.
naturopathic doctors are covered under insurance plans now.
And it's growing. It's definitely growing, and you can talk to your insurance company. You can talk to your local naturopathic organization, and yeah, look for a good local naturopath in your area.
And a naturopathic doctor can do everything in a sense, like if you're thinking you're a pediatrician and you're looking for your baby checkups and you're looking for just your annual physicals. Is that something a naturopathic can do?
In those regulated states, yes. So you'll find there's certain regulated states, and there's more and more states that are becoming regulated with naturopathic doctors that can do primary care medicine.
That's fantastic. And so to me, it makes a lot of sense because, one, you want to establish a relationship with your doctor. It's very hard to establish a relationship in 3 minutes if you see your doctor maybe once or twice a year.
Yeah. And the other thing is, yes, naturopathic doctors can, in those regulated states, provide blood work and also integrate with local doctors, with local pediatricians.
That's what I was going to ask next.
And be able to really be a conduit for your health, because you want someone that is medically trained, but also trained to make sure that you're looking at that true cause of disease processes, and just being able to make sure that if there's anything that could be serious, a physician trained naturopathic doctor uh, is able to refer out or knows when there's a serious complication.
And it sounds great to have just another member on your team for wellness.
Yes.
And that's what it sounds as though you do.
Correct.
I love that. Now, if somebody's trying to find a naturopathic doctor, is there websites for somebody to find somebody if they are in a particular state? Like, for example, California. Is there a directory that you can go on and find that state?
Yes. I know California has the Association of Naturopathic Doctors. They also have a government site as well that you'll be able to see who is licensed. So always ask for a license number, what school they went to. If you're asking, there's also I believe the AANP, and they are the Association for Naturopathic Physicians in America. If you're in Canada, there's also the Canadian Naturopathic Association. So you'll find that you can get the website, and hopefully I'll be able to get that for you that you can have posted as well.
That'd be
I don't have it on the
fantastic.
top of my head.
And for people who want to learn more about your work, how do they find you?
Well, my website is drzayd.com. So DR and my first name ZAYD.com. I also, because my main practice is with hyperbaric oxygen therapy, I have a website called hyperbaricexperts.com that I help manage. And that's a website that what I've done is get the latest research and, and, and make a little summary of each study so the patients can actually get an understanding of what the literature is saying, but then the hospital or the doctor or the practitioner can click and get the study and or the abstract, and sort of bridging the understanding of hyperbaric medicine throughout the community. So those are two websites that are accessible for me.
That's wonderful. Now, for those families out there that they're watching and maybe they're newly diagnosed, maybe they've been on this journey for a while, and maybe they just feel a little bit lost and helpless, and we all get there when we're trying to turn to find help, right? What message can you leave with them?
Oh boy, yes. I've seen a lot of kids with all sorts of debilities from mild to severe, and everyone says, "Oh, is it too late? What can I do?" And you might and a lot feel responsible as well. And I would say let that go and take care as a caregiver. Take care of yourself. Take care of yourself because your son or your daughter is relying on that care, and then understand that it is a journey, and sometimes we tend to try to do everything all at once, and I see families coming in and they got their schedule, 8 in the morning I'm doing this, 10 I'm doing that, and sometimes maybe just phasing things as this month, this will be an important part of the schedule. Let the kids also be kids, not just always in treatments, okay? And being able to really slowly focus on the journey to health. And as you start this journey, you'll see it can be done. And so we've definitely seen such an amazing amount of integration with the Medical Academy of Pediatric Special Needs Doctors, and being able to really focus on this helping accelerate the growth and catching up of these children while still being able to be kids and children.
That's such a great message.
Thank you.
Thank you so much for everything you're doing to help our families and help our community. And thank you for being here today.
Excellent. Thank you very much.